Hello, and welcome to Genetic Testing and Genetic Counseling. We're going to talk about why anybody would want to go get genetic counseling and what it means to be a genetic counselor and some examples of genetic tests. So, what do we have here? Common reasons that we'd seek genetic counseling? Yes, if a person knows there's some sort of genetic disease in their family, family members are afflicted by epilepsy or hemophilia or some genetic disorder that is pretty well known. If a couple has already had a child with a problem, to see if it's genetic and see what the probability of their next child or any other subsequent children would have this abnormality, right? Pedigree analysis. Anyone in the family who has issues that may suggest Down syndrome or another chromosomal disorder. Older women, right? We know that there is some disagreement about the age at which mothers are at risk for chromosomal issues, but generally suggested age 35 or older is when there's an increase in chromosomal abnormalities. If there's consanguineous relations, like we talked about in the pedigree analysis, and if people have trouble conceiving, they can look for genetic tests and counseling to see if there's an underlying genetic issue. Environmental substance exposure while pregnant can cause birth defects, so you might want to look at the fetus at that point. You got prenatal testing and you need help looking at those results. So generally they won't even give you those tests back without seeing a genetic counselor to have them read it aloud to you. And then obviously if we're known carriers or belong to a group that has a high frequency of a genetic disease, even if they don't know any family members, for the high frequency, you'd want to seek some genetic counseling for that. And so here's an example of some types of genetic tests. So a sonogram, right? The ultrasound that's pretty standard for when you're pregnant to look for genetic traits, some genetic diseases, some big issues can be seen by ultrasound, but most genetic tests need to go through either one of two different types of prenatal diagnosis. One would be the amniocentesis and the other is CVS. And so let's talk about amniocentesis first. So this is when the ultrasound guides the needle being inserted. You want to get it just into the amniotic fluid. That's what we call it, amniocentesis. So don't poke the baby, don't poke the placenta, just pull out some of that fluid. And that fluid contains shedded fetal cells, right? So, right, from skin, whatever, just like our skin regenerates and we shed skin cells, fetuses do as well. That's pulled out. We get those fetal cells, grow them up enough so that we can do chemical analysis, DNA analysis, and that chromosome spread. So the big chromosome spread is looking for major chromosomal disorders, Down syndrome, any of the non-disjunction events that we'll talk about in the chromosomal chapters, and then some DNA analysis if they want to check for known mutations in specific genes. And then what is CVS? CVS is performed so amniocentesis is usually performed between 18 and 20 weeks or after. CVS can be performed much earlier, 10, 11, 12 weeks. Same idea, we need that ultrasound, but this time we're trying to pull cells from the chorion. That's what would be the outer layer of the placenta. And so instead of poking through the uterus, which can be dangerous, they use a catheter and go up through the vagina through the cervix and up and pull some cells out of the placenta. Remember, the placenta is made by the baby. Remember that trophoblast cell layer that we talked about? Right, when I draw our blastocyst, right, that outer layer becomes a placenta. That's all fetal cells, so that's all fetal DNA. So you're going to get the chromosomes from the baby or the fetus, right? And then you're going to have these, and then you do the same stuff that you can do from amniocentesis. You can just do it much, much earlier in the pregnancy. So what do we see? So some examples of genetic diseases and disorders that can be detected prenatally, right there. So we're going to talk about any of the chromosomal. So that's the big chromosomal disorders, Down syndrome, the main one. You can look at some of the bigger things by ultrasound. So if the infant fetus has a cleft lip or a cleft palate, that's when that doesn't seal up and they have a split in their lip. You can see dwarfism by ultrasound. So if we look through just looking at ultrasound or x-ray, ultrasound right there. So some of those brittle bone syndromes. The rest of these all require either amniocentesis or CVS. So looking for hemophilia, some of the major syndromes, a neural tube disorder, sickle cell anemia, and Tay-Sachs disease. So other kind of genetic disorders that can run in families and certain ethnic groups. So what's the difference? What is pre-implantation genetic screening, you might ask? This is what we talked about at the beginning of the semester when I went off on my little tangent about stem cells, and we talked about, right, when we start with, we'll start with our little, wrong color, start with our little zygote guy, and this would be, what, IVF? We have to do this in vitro. There's no way to do pre-implantation genetic screening unless it's in vitro fertilization. So our zygote then replicates into a bunch of cells within the first day or so. And then we pluck one off right there. That guy comes off. And that's what we do the genetic testing on. Right? So we could theoretically, we'd need to just do the PCR DNA test, because it'd be really hard to get a chromosome spread. But it's possible we can push this guy to go through mitosis, right? That's the only way we can see the chromosomes, and then look and see if there's any major chromosomal abnormalities. But you can look for all the common mutations and diseases. So, for example, if you're an ethnic group that the BRCA1 genes run in, BRCA1, those are breast cancer, prostate cancer genes, you could test for that. And you can test for anything else. If this cell looks okay, that means all these cells are okay, so then you can continue your IVF, make your blastocyst, and go to implantation. If there's major chromosomal disorders in the one they pluck off, that means these guys have major chromosomal disorders, and then it's up to the parents whether they go here or here. It would be recommended to go to the trash, but it's really up to the parents of that embryo to implant or not. So that's pre-implantation. And so how does pre-implantation genetic diagnosis differ from prenatal genetic testing? Well, let's pause, take a little studio quiz, and then come back. Okay, we're back. So I set it up as multiple choice, but, right, we talked about these two, right, before pregnancy, the very early stage before implantation. Prenatal is once there's a fetus. So that's the main difference. And then, my friends, what about interpreting these genetic tests? What if you're not a biology major? What if you didn't take genetics? What if you don't know anything? Well, then you're going to need a genetic counselor. And so all the different genetic tests available can be complicated by lots of, right, numerous mutations. So you might be checking for BRCA1, BRCA2, but breast cancer and prostate cancer can also be caused genetically through other mutations that run in families. Remember, incomplete penetrance and then environmental factors. You might find a mutation. Mutations, yes. Disease, no. So you're not sure for many of those because of, right? It's complicated. And then genes and environment, we talked about that with the twin studies. So interpretation of genetic testing is also difficult. But here are a list of mandatory screening that happens for newborns. So when babies are born, they get a gazillion blood draws, well, not a gazillion, 1 or 2 blood draws from their heel to do all these genetic testings, because some of these, if like PKU we talked about, if caught early, and as long as you keep phenylalanine, that amino acid, out of their diet, they can live a totally normal life. If you don't, it causes brain damage, and that, that child is screwed. So a lot of these things you can catch right away, the first day, right? The first day the baby's born, or the first week, so that they can be treated or change their diet. And so most of this newborn screening is things that are able to be treated early with diet or medication, or, right, there's hearing loss, so you can do hearing aids as soon as possible, and that sort of thing. Cystic fibrosis, you can start that child immediately on treatments. Galactosemia, same idea. All of these, most of them are metabolic disorders, so as long as you can re-add back the enzyme or remove the precursors that cause the problems, the child can be perfectly fine. Otherwise, if you don't, it leads to brain damage and usually death. So that's not good. So what's the problem with genetic testing? So you can get genetic tests done now, 23andMe. Woohoo! People worried about discrimination, and that did happen for people who had carried that sickle cell trait, so they were heterozygous for sickle cell anemia. They had trouble finding health insurance. They said that was a pre-existing condition, which sucks. You can't help that. That's not fair, and nobody would know if you're just a carrier, right, unless you had the genetic test. And so then Non-Discrimination Act was set up so that employers can't look at your genetic testing, and insurance companies can't either before they offer you insurance. And it's a little bit iffy now, though, with the insurance companies, with pre-existing conditions and all of that kind of stuff. What else? So how do you become a genetic counselor, you might ask? Oh, what? Yeah, it's a cool job. So here's a bunch of information. So the National Society of Genetic Counselors says you must obtain a master's degree in genetic counseling, and it must be a program that's accredited by that council. Completion of that master's degree, then you sit for a board award. So it's just like the medical boards that med students would take, but you only need a master's degree to do this. And then if you pass that board, then you get that certification, and then you can be hired as a certified genetic counselor and start making the big bucks with so what's the deal? There are 49 accredited programs in the US and Canada, and so you can just Google that if you want to find them. CSUN used to have one way back when, but we lost our program because of funding and illness in the directors. So it's always possible that CSUN could start another program, but UCLA now has a brand new master's degree in genetic counseling that anybody interested should go check out. It's usually a 2-year long master's degree with some clinical hours involved, coursework, clinical hours, studying for the boards. But there are a few that are a little bit shorter and a few that are a little bit longer, and most of them are set up so that you can pass those boards appropriately and get in your clinical hours so that you are ready to take the exam and become a genetic counselor. What else? So most applicants, right, have a degree in biology, but you don't have to. But the prerequisites are all essentially all the biology courses. So it'd be good to take, if you're interested, some of your upper division GEs in psychology, or lower division if you have any left, or even if you don't, just as an extra course. Stats, right? The health science has a biostats that's actually much better than the biology. We have a 330, but that is really for eco-evo people, so not so much for molecular and genetics. Many places require you to take the GRE, although, right, GREs are being pulled from lots of different programs, so there may be some other type of exam. And then some programs require some counseling experience or advocacy work. This is all volunteer. So if you're looking for experience, there are crisis counseling centers that are looking for volunteers all the time. And then you should really research each program's requirements because they sometimes have a few different things. So you don't want to be doing extra coursework that's unnecessary unless you think it would really help you just in general and get you towards your degree. What else? And if you want to apply for a master's in genetic counseling, Google all of these different sites that will give you lots more information on this career, which is good, lucrative, just a master's degree, no medical school and residency, no PhD needed, and so it's a little shorter way to a really great career. So that's it. Thank you for listening. Appreciate it.